I'm Amy Isaacson, and this is Resiliency and Children. What resiliency is and what it is not. Resilience is the successful adaptation to difficult life experiences, as well as the successful adjustment to external and internal demands. Resiliency can mean having an optimistic outlook on life, possessing good coping mechanisms, and being emotionally regulated. Some people may think that resilience is numbing your emotions, ignoring your problems, sitting in denial, or avoiding seeking support. Some people might have the idea that if they are able to suppress their emotions, that they may come off as emotionally strong, but that's just not true. Traits of resilient children. Problem-solving skills. For a child, for an example, this can look like if they have a conflict with a friend, they're able to go talk to that friend. An internal locus of control. This means that they know that they are in control of their actions and the outcomes of their actions. They can ask for help when needed. For example, if they are doing a homework assignment and they don't understand a question, they're able to ask the teacher or a friend for help. Indulges in a hobby. So this could be something like a sport or art. They are optimistic. So this means that they have a good outlook on life. They're optimistic about their future. They can communicate effectively, which means that if they are feeling a big emotion, they're able to talk about their emotions. Protective factors and risk factors. Protective factors are characteristics that lower the chances of experiencing adverse childhood experiences, also known as ACEs. Protective factors can be something like being involved in a hobby or a sport. It can be having a stable home life, having good family communication, feeling safe at school, having good role models, and having positive self-esteem. Risk factors are characteristics that increase the chances of experiencing ACEs. A risk factor can be low self-esteem, chronic illness, conflict in the home, unstable housing, unstable home life, parental neglect, if they feel unsafe at school due to something like bullying, and lack of community resources. Why resiliency is important for children. Resilience helps children overcome ACEs. Resilience reduces anxiety and depression in childhood and their teenage years. Resilience builds strong protective characteristics. Developing resilience in childhood is proactive. It will help them face the future. It can help them face life events such as death of a loved one, bullying. When they're teenagers, it can help them face breakups. And in general, it can help them face something like family stress. How children build resilience. Children build resilience through numerous sources. A few examples are stable home life, community connections, consistent routine, and achievable goals. Some kids are born with more resilient traits just genetically, but that doesn't mean that kids who aren't can't develop it through these examples. It matters that a child builds resilience because it affects how they're going to grow up and who they're going to be. So a child who has fostered resilience will grow up to be able to reach long-term goals, such as getting a career they want, following through college. They can solve their problems independently. So as adults, they don't need to be calling mom for help all the time. They will be able to manage their own life by themselves. They can manage their emotions appropriately, so they won't be having big breakdowns. They won't be screaming at people. Like, they'll just be okay. They can be self-reliant and self-sustaining. So this means that they don't really need anyone to take care of them. How to foster resilience in children. There's a thing called the 7 C's of resilience. This is competence, confidence, connection, character, contribution, coping, and control. Starting with competence, this means that they can handle various situations. This is usually acquired through experience. They can develop skills that allow them to trust their own judgment, make responsible choices, and face difficult situations. Some ways to help your child become more competent is to not be so super overprotective. You can focus on their strengths and build on those strengths. And also allow your child to make safe mistakes and then allow them to correct those mistakes. For confidence, this means that a child can recognize when they do something correct. To help your child feel more confident, you can avoid shaming your child and do not push more onto the child than they can handle. When it comes to connection, things that help the child build connection is having close ties to family, friends, school, and their community. Having this trait means that they have a solid sense of security and strong values. Connection prevents the kid from attention-seeking behaviors as well. So if they feel like they are connected to the people around them, they won't feel like they have to turn to potentially damaging attention-seeking behaviors. To build connection in your child's life, you can let your child express their emotions freely to build a connection with their family, including the mother or father or guardian. It's very important. You can embody good family communication and also work together with the child to resolve problems. When it comes to character, this means that the child has a sense of right and wrong. They can stick to their values, they care about others, and they have a solid sense of self-worth. To help your child build their character, you can explain how their behavior and actions affect other people. You can encourage the child to think about what is right versus what is wrong. You can teach them to look past immediate satisfaction, especially when you have them think about what is right versus what is wrong. And most importantly, you can serve as a role model for them to role model caring for others. When it comes to contribution, this means that the child feels a sense of purpose. You can teach the kid that they make the world a better place and teach them how they can do that. You can teach them the value of helping others and the concept of the greater good. To do this, you can model generosity. So this means, like, if you see a homeless person, maybe you can buy them some food to teach your child generosity, things like that. And you can also find opportunities that allow the child to help, such as volunteer events. When it comes to coping, this means that the child has the ability to use a wide variety of healthy coping mechanisms. Children with good coping strategies are better prepared to face challenges. To help them better cope, you can model healthy coping mechanisms, and you can also provide a family environment that is open to talking and listening about feelings. For control, this is when the child understands that they are in control of their decisions. This is also known as an internal locus. To help build this internal locus and control, you can help the child understand that all events happen due to choices. You can focus on taking one step at a time, and you can allow the child to make decisions so they can learn control and how their actions affect others.